You're watching Buzz with Jess Lujan.
Sleep disorders are our subject tonight with Dr. Bartlett from the Guam Sleep Center. And Doc, before we talk about snoring and narcolepsy, my understanding as well, when you first were going to start the Guam Sleep Center and get certification by the American Academy of Sleep Medicine, you had the hardest time because Guam wasn't in the they didn't know Guam wasn't a state. Guam was, I guess, non-existent at the academy.
It was a territory, so
yeah, okay.
we had to fight a little with the board of directors,
Mm-hmm.
but now they actually turned it around, and one of the slogans when you go to the American Academy of Sleep Medicine or AASM website,
Mm-hmm.
they boast, from Guam to Maine to Alaska, we cover all of America.
Cover all of America.
So now
Oh, okay.
Guam is like their flagship. That's
Okay.
how far they are
How far?
out in
But
the Pacific.
you have to prove that first, right?
Well, yes, yes.
There we go. The other thing is you're going to be having a partner here shortly in the next month or two. He's a Harvard grad, right?
Yes,
yeah.
he was trained at Tufts
University, yes.
right?
Mhm.
And his name is Dr. Michael Slattery.
Okay.
He's going to be help for the sleep center
Mhm.
as a board-certified sleep doctor, but he also is a board-certified neurologist, and
Neurologist, okay.
neurophysiologist.
Wow, okay.
Which means he will be doing EEGs, EMGs, nerve conduction studies, general neurology, and help me with the sleep studies.
I mean, that's
Guam is getting another neurologist.
It's a specialty that is in great need out here as well.
Yes.
And we thank you and again for introducing him to Guam and wanting to come out here.
Yes,
And-
he's
and-
actually a petty diver, so I lured him with the great diving on Guam.
There we go. And they say we don't have medical tourism. Yes, we do. There we
That's
go.
right.
Yeah. Let's talk about then snoring. You touched a little bit about that. How about the severity, the degrees of snoring versus narcolepsy? Does one lead to the other? Does one become a more potent or severe snorer before narcolepsy? How does that happen? How does narcolepsy happen?
Okay, actually, there's a lot of misconception about the word narcolepsy,
Okay.
because everybody who is excessively sleepy, people say, oh, he's just a narcoleptic. And actually, narcolepsy is a very rare neurological disorder, which is completely different from sleep apnea.
Okay.
Because sleep apnea is due to a physical blockage of the airway,
Okay.
and narcolepsy is due to neurotransmitter imbalance in the brain. And narcolepsy patients are the ones that usually start with excessive daytime sleepiness pretty early, like in their teens.
Okay.
They're usually thin. They have ancillary symptoms.
So
such
almost the opposite of
Yeah.
sleep apnea.
Well, yeah.
Kind of, sort of.
The common thing is they're both tired, and
Okay.
they both can fall asleep at the drop of a hat.
Okay.
But the narcoleptics actually also have something called cataplexy,
Okay.
which is a sudden loss of muscle tone. They go limp when somebody, for example, tells them a joke or when something exciting happens
Sure,
on TV.
sure.
They have hypnagogic hallucinations, which is imagery like hallucinations, but they're not schizophrenics. And then they have a condition called sleep paralysis, where they lay in bed, they're awake, but they're paralyzed. So narcolepsy is a condition that needs to be diagnosed also by a sleep specialist, but it is not sleep apnea.
It's not sleep apnea.
But
Okay.
they both have excessive daytime sleepiness.
Okay.
And so can a patient with restless legs can have excessive daytime sleepiness. Patients with insomnia are sleepy. Patients with tooth grinding may be sleepy during the day because they just wake themselves up by tooth grinding. So the common denominator is my patients come in because they're tired during the day.
They're tired during the day. Now, I mean, narcolepsy could definitely be a very dangerous, most especially if you're operating some, whatever machinery
Yes.
you're operating could be very, very dangerous because you don't know the onset. I mean, does the patient that have narcolepsy, do they feel the sleepiness coming on, and then maybe they can pull over before that happens, or can they take measures, before even the diagnoses that they can prevent to keep them safe or whoever they're servicing safe?
Yeah. Well, normally in regular sleep-deprived people like you and me who just don't get enough sleep, or in narcoleptics or in sleep apnea patient, there are warning signs that they should pull over. For example, their eyelids droop, or they have to turn up the radio, or they yawn excessively, or they just know that they're about to fall asleep. So yes, they should pull over. Anybody who is sleep deprived or has narcolepsy or apnea should pull over before they actually fall asleep at the wheel.
You know, I get that when I'm driving from San Diego to LA, you know, after my first hour on the freeway, I do that. But anyway, I know it's just being bored of driving.
Or sleep deprived.
Sleep deprived, or both, or, yeah.
Many jobs and kids.
You talked about restless leg syndrome.
Yes.
What is that?
Okay, restless legs is an uncomfortable or kind of, it's unpleasant, but to a degree where people, it drives them so-called crazy, because they have this feeling in their calves that they have to move. And they say, well, I have soda in my legs, I have spiders crawl in my legs, and they get up and they have to walk around or ride a stationary bike, and then they can lay back down, but it keeps them awake. So some people can't fall asleep for 2 or 3 hours because their legs are so bothering them that they cannot fall asleep. And obviously, if you only have 6 or 7 hours to sleep because you got to get up in the morning, and you curtail your sleep by 3 hours in the evening, then you will be sleepy during the day.
So the restless leg syndrome, I mean, it's not the same as, I mean, people, I mean, I've had this at times where I've woken from a deep sleep because I had bad calf cramp or even a hamstring cramp.
Okay,
I mean, it's not,
that's different.
Kind of,
Cramps are different than restless legs.
Okay.
Restless legs is just a subjective feeling of unease and restlessness. Whereas cramps, you can actually feel the hard muscle on
balls up,
balls up. So that's a different condition.
A different condition, but but it's not associated with a sleep disorder. It's another disorder.
No, cramps is usually just you can drink quinine water, or you can have some medication for it, but that's not a sleep disorder.
Okay, let's talk about. I mean, we've talked. I mean, you know, Psych 101 talks about REM sleep. You know, and the different degree. You know, REM sleep leading up to that. How important, you know, we talk about as we age, we seem to require less sleep. At least I've noticed that. You know, that doesn't mean it's good, but it seems that in the younger and your growing years and things like that, you're needing more rest, you're needing more sleep. How important, and as people age and requiring less, how soon does one hit the sack and then get into the REM sleep? Because that is the most, that's the deepest sleep that one gets into, right?
Not quite. The deep sleep is actually called slow wave sleep, and that's highest in adolescents and young adults. And that diminishes greatly, and by age, like our age, it's usually gone. But yes, it's the sleep stage in which growth hormone is secreted. So you need it a lot when you're younger and growing up. REM sleep is the dream sleep part, and that actually remains fairly stable over your lifetime. And
so that's what I'm dreaming about, my hormones.
Well, you probably remember dreams when you wake up.
Oh, okay.
Okay, so the dreaming actually does not decrease in quantity.
There we go.
And in terms of the sleep quantity in general, it's true that teenagers should actually have 9 to 10 hours of sleep. Younger children, almost 16, you know, the really young children. And then adults, they sometimes curtail their sleep when they work 2 jobs maybe, and they just don't get enough sleep. But it's not that you need less sleep. Sleep need is actually born with you, like your hair color or your eye color. So, and some people are 6-hour sleepers, those are the lucky ones, and some people are 9, 10-hour sleepers. So many times when somebody comes to me and says, you know, doc, I sleep 8 hours and I'm still sleepy, I tell them, well, look, you may be an unlucky long sleeper, go on a vacation and sleep 9 or 10 hours and tell me how you feel. And then they realize they need 10 hours, and then they have just to put in naps or go to bed earlier. So the sleep quantity does not really decrease, but the distribution, like old people, they sleep during the day, they nap in their rocking chair, and then at night they only sleep 4 hours.
I
But
see.
with the 4 naps, they get
There
the
we go.
same 8 hours like before.
Doc, we take a quick break and we'll come back and finish this off, okay?
Okay, very
Be right-
good.
Be right back.